All right, we're going to demonstrate elbow range of motion. This is meant to be passive range of motion. You can have the patient do an active from this position as well. But really what we're trying to gather here is their full available range actively, then passively. And we also get end feel or our overpressure concept done here. So Paulina is my patient here. I'd ask her to bend it as far as she can. So go ahead and bend it as far as you can. I'd ask what her response is, but then I have the opportunity to take it through passively and then really get a good end feel. Now there's not a lot of stabilization needed with the towel. I can just press down to get a good end feel this way. If I needed to, I could stabilize her humerus and get in, but I'm getting a stretch, maybe some soft tissue there, about the same for you. So that would be flexion, active, and then passive with overpressure. We'd then transition directly to extension. We like the pad underneath the humerus so that she can get into hyper, and Paulina does have hyperextension here. So I can let her passively rest. I wouldn't need to do a lot of overpressure, but if you did with a case, you'd keep your hand underneath the humerus, driving this way. Again, you could come up onto the above the wrist to really get a good end feel, but I'm getting a little bit of a stretch, not much of a firm end feel. You're getting a stretch here, if anything, yeah. So that would be flexion and extension. For the elbow, the proximal radial ulnar does do some pronation and supination. So two ways you can check that would be at 90 degrees, taking the distal wrist through full supination, seeing if you get any end feel this way. Then you'd also take them through pronation. Again, assessing more proximally here at the elbow to see if there's any end feel that you get, trying to grab both bones to really make sure you get the radius to come all the way into pronation. Any response with this one or this one for you? If you've gone down to extension and already assessed, you may redo that, especially if they have a limitation, or if you want to clear, take them here into full supination. We can respect that the bicep gets a little bit of a stretch. And then we can also take them into full pronation. Some people will measure extension this way, the pronation, because the radius doesn't change the angle of the elbow too much. So you can put them here to get full extension, or here. Test it out and see patient end feel. Really, if you're going to get extension, you want to get them all the way down into supination would be ideal. Pronation may give you a better end range without a soft tissue restriction. So to wrap it all up for elbow range of motion, we would do full flexion, end feel, we're expecting soft tissue or joint stretch. Get down here, we're expecting hard bony approximation or maybe some ligamentous capsular stretch. As we move into pronation and supination, at 90 degrees, you're not expecting a whole lot of resistance here. Pronation, you may get a little pull from the bicep. Into full supination, you may get a little bit of resistance, but for me, this is mostly soft tissue stretchy. Down in this position, when you get your end feel, you might get into bony this direction. You might get into bony or firm this direction when you do pronation and supination.